Okay, today we're going to be treating a patient who has several problems, one of them being herniated discs at L4-5, L5-S1 on the left side. And we're also going to be treating facets. Lay still. Of course, our patient is awake for the beginning. Where do you feel that? I'm sorry? Good. That's what we expect. So we have an agenda here for the patient. Very good. That agenda includes the L5-S1 and L4-5 discs need to be repaired on the left side with Duke laser disc repair. And then he's going to have the Duke plasma rhizotomy to treat his facet pain. Shot. And he's going to have thoracic facets treated and cervical facets treated. I do it for him only because he is one tough customer. Right? He's demanding. He told me I had to do it. So I'm doing it. He's the kind of patient I really like because he knows what he wants. Right? And num. And I'm going to give you some numbing medicine. Make you feel better. Okay? And he told me exactly what he wanted. So I almost felt like an employee at the McDonald's drive-in. Right? You know, he showed up, all right, I want some fries and a shake and a cheeseburger. Right? Anyway, he knows what he needs and wants, and he said, I want my 2 discs fixed at the bottom, and I want my facets treated, and I want my thoracic facets treated and my cervical facets treated. I said, okay, let's do it. So here we are. Any pain? Where? In the back? Not down the leg? Shot? Uh-huh. Shot? I'm hitting the top of that vertebral body. AP? All right, so far everything's going well for this gentleman. Now, he has what we call a pseudo disc or fake disc at S1, S2. If you look at the bottom needle, that's the disc below. It's not a real disc. All right, not bad. Everything's going well for you, okay? You can see he's got a little bit of scoliosis. Nothing to worry about, nothing that needs treatment. We're literally in good position. I just need to make a small adjustment and we should be fine. Shot? You're doing great, my friend. Doing great. We're going to be putting you to sleep in just a few minutes, okay? Just don't move around. You're doing really good. Shot? Need to come a little bit higher. Where do you feel that? Where? Just the back. Not down your leg, obviously. I think you're off on WAG. Fix your WAG at 4.5, please. It's throwing me off. Shot. Don't lock it in until you get it right. Yeah. We're literally hitting the top of his vertebral body there in the back where there's a slight elevation. Shot. So I'm going to try to redirect just a little bit. Same area? Shot? All right. Well, Sorry about that. I know it's a bit uncomfortable. We're almost there. There we go. All right, so perfect. Everything's going really well for you, okay? Yeah. All right. Anyway, not going to do a high volume, right? You have, so let's go ahead. This is 4-5 and 5-1. We're going to do a low volume injection. As soon as we're done with this, we'll put you to sleep, okay? I just need you to be awake for just another minute. I cannot see past this thing. There we go. All right. You feeling anything?
Having any pain in your back? Okay.
Shot? Huh? Is that uncomfortable? Huh? I can't understand what he's saying. No. Good. All right, we're going to put you to sleep, okay? So basically, we've just done our discogram. I did a low volume. I don't want to blow out the other side. The other side has been treated, and successfully, obviously, because he didn't have any discomfort. Well, we're going to clean this side up. I want you to count from 1 to 100 for me, okay? Can you count out loud? Go ahead. When you wake up, we'll be done with surgery. Shot. Uh-huh. Doing great. Keep counting. We did some num-num in the discogram. You're doing great. Keep counting. Keep going. You're doing awesome. Don't move. Need you to lay still. You're doing great. Everything's okay. That's just medicine going in your arm. Keep counting. Nice and loud. All right. Shot? So far, so good, right, doctor? Yeah, so the last patient's fine. He had zero pain, doing wonderful, and just shifted in his chair to get up and popped the facet. No, he had no pain. I mean, he was so happy. Yeah, I know. It's facet. I'm 100% sure. Lay still. He has bad facet arthritis. And was fine. You guys can see the pseudo disc below. You want me to wait a minute or? Okay. So just lay still, you're fine. Let's have, how much time do you think you need? Just think about the facets. I don't think he needs that much time. Huh? We were just getting ready to start on the facets. No. No, I'm not. I promise. Hold on. Let me just see. All right, I think we're good there. Go ahead. Mm-hmm. Uh-huh. Again, this is the what we're calling the L4-S1. There is something below which we're calling S1, S2. Again, different doctors will ascribe different labels to what's called a pseudo disc. A pseudo disc means a fake disc. I think you're off a little bit. Let me do it. Hold on, I got it. key is to not trap your glove. Shot. And not advance. That's working. All right, almost done. Perfect. Go ahead, shot. So at this point, we're inside the left side of the L4-S1 disc. It's going very well for him. He's snoozing very comfortably. We're going to get in there and take a look, but he has annular tears and a small herniation at L4-5, L5-S1. Again, he knows his stuff. He told me I want that fixed along with the facets. I said, okay. Your wish is my command. I'm here to make my patients happy. I think it's reasonable to do. A lot of people have facet and disc pain. He's one of them for sure. So he wants to get both fixed. Any questions from the audience?
No current
Laser.
questions.
Let's show the audience, laser. Why do is he okay? Yep. Why do herniated disc actually cause back pain? What is it about a herniated disc that causes back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right. We were just talking about how spinal fusions throw the alignment of the spine off. And the reason they do that is that most doctors that do spinal fusions really don't pay attention to the what's called sagittal balance of the spine. And the sagittal balance is basically how your spine sits on top of itself at each segment, all right? You have to think about the spine as having individual segments. L1-2, L2-3, each of those are joints, and each of them is wanting to be in a comfortable position. So when you do a fusion as a surgeon, you're potentially fusing the spine in bad alignment so that the gravity line goes through each segment above or below the fusion in such a way that it puts abnormal stress onto the joints of that segment above or below the fusion. And if a surgeon doesn't fuse the spine perfectly in good alignment, which happens about 90% of the time, then the patient's going to have adjacent segment disease that they're symptomatic from. And so that will put abnormal pressure on joints like discs and facets. So this is the left L4-S1, and you can see a lot of scar tissue already from inflammation, chronic inflammation. It's been going on for a long time.
We have a question.
Sure.
This comes from Lubisa on Facebook,
Uh-huh.
and they said, "Hello, is your surgery the same as endoscopic annuloplasty?"
Is my surgery the same as an endoscopic annuloplasty?
Correct.
There is no such thing as an endoscopic annuloplasty that I'm aware of, but ours is what we call an annular debridement. We were the first to do it, So if anybody else is doing this, they're copying what we've done and we've been doing for 16 years. I'm not sure what an annuloplasty is. So I don't know what they're talking about with annuloplasty.
We have another question.
Yep.
This comes from Jan on YouTube.
All right, but just so you know, the first question, when you say, is your surgery the same as an endoscopic annuloplasty, that would be like me saying, you're drinking a soda, you must be drinking a Coke. Or you could be drinking a Pepsi or a root beer, or you could be drinking any number of 7-Up, any number of sodas. So there's not enough information given with your question for me to be able to tell you. But if the endoscopic annuloplasty is the same thing I'm doing, then they've copied our technique. And that wouldn't surprise me because people are going to start copying what works. But at the time that we developed this technique 16 years ago, there was no such thing as a endoscopic annuloplasty. So maybe it's a newer term or newer technique, I don't know. Go ahead, Henry. What's the other question?
This question from Jan on YouTube. They asked, should I go to the chiropractor if my neck is in a lot of pain and no movement capabilities?
Yeah, so the question is, should I go to the chiropractor if my neck is in a lot of pain, I'm having trouble with movement? Chiropractors are great for helping with basically stiff joints in the neck. You just have to be careful to make sure that you don't have nerve damage going on or spinal cord damage, that you don't have significant stenosis or narrowing, you don't have instability. And if you don't have instability and you don't have spinal cord or nerve compression or damage, then it's fine to go to the chiropractor or physical therapist to help try to restore some movement in your spine. There's nothing wrong with that. On the other hand, my experience has been that chiropractors are not going to get your movement back. You need to treat the source of the pain. Chiropractors, in my opinion, cannot fix the source of the pain. The source of the pain is going to be your disc or your facets. And you're not going to be able to tolerate the manipulation that needs to happen with the facets in order to treat facet pain, which is only about 15% of the pain anyway. So what I'm saying is, if your facets are the cause of your neck pain and stiffness, the chiropractor can manipulate you, but it won't work because you're not going to let the chiropractor move your neck. It hurts too much. So chiropractors used to do something called manipulation under anesthesia, and that's where they would basically put you to sleep and then crack your neck so that the pain from the cracking of the facets was tolerable because you were sleeping. Did you ever do manipulation under anesthesia? Berndes? Yeah, so it was a very popular technique years ago. Nowadays, we do something different. We do what's called a rhizotomy. We go in and basically deaden the nerve to the joint, and then we do therapy. All right, lots of scar tissue in this disc on the left side. Chronic scar tissue. Clearly been there for a long time. Great questions. Man, there's a mountain of scar tissue here. Look at that. Clearly a damaged disc from a long time ago. Years and years of inflammation causing scarring. Any other questions?
No current questions.
Let's show the video on how the Duke laser disc repair actually works.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Towards you. All right, welcome back. You've had a chance now to see from our video how the okay, we need another laser fiber. Right? No, we heard it. It's not here. It's over there. You need to find it. Turn the light on. Let me have a grabber.
And Jordan, do me a favor. Turn off the machine. Turn off the machine. You see on the left side, remove this laser fiber. On the left side, there's over here, right there, there's a little chamber there. You know what I'm talking about, Jordan? On the left side? Okay, we need to open that and change.
All right, what question do you have for me?
We have a question from Robert Campbell on YouTube,
Uh-huh.
and they asked, "Good afternoon, Doc. I've had a 3-level fusion done about 6 to 7 years ago. Now have radiculopathy. Is this something that could relieve my nerve and back pressure?"
Yes. Yeah, so the viewer is asking us, hey, I had a fusion 3 levels years ago. Now I'm getting pinched nerve symptoms again. Is this something that can help me? And the answer is yes, it can. As a matter of fact, the patient we just did before this, if you go back and look, he had a 2-level fusion in his back. And we just did his next segment.
You know what I'm saying? We have a flathead driver there in that back probably. So we need to remove that.
All right. It's looking pretty good there. I'm done with that disc.
Or any piece or whatever.
Not so bad.
We can do it. We can keep.
I'll take care of all of this. You focus on that. Great questions so far. Do we have some more questions?
No current questions.
That's for the... Luis, you focus.
So I'm going to put everything over here.
Mm-hmm. I'll take care of it. Great. Why don't we, we've already done the video showing how the Duke laser disc repair works, correct?
We showed the neck pain and the DLDR, yes.
Mm-hmm.
Back pain, excuse me.
Yeah, no problem. I understand. All right. Right now we're irrigating with antibiotic solution.
We do have a comment from Robert. He replied, "Thanks, Doc. I'm looking to get a new MRI to send to you through your website."
Yeah, thank you. That's a great idea. That way you get an opinion on what's going on. Robert, you want to know, you know, is my current problem a result of like problems where I had the fusion, or is my current problem a result of like a new problem next to the old problem? All right, 1 down, 1 to go. I've got this. Mm-hmm. Oh, no pain. Yeah, he had no pain. No pain at L34 or L45.
All right, somebody grab this one.
No, no, when there's no pain, there's no concordant or non-concordant. The only time you talk about concordant or non-concordant is if there's actual pain. Take your time. Jordan, are you able to bring in the fluoro? All right, we're going to move to the next disc. You guys see the scope here? Henry?
Yes, yes.
So
Yes, we do.
everyone can see what it looks like. Come on in. Bring the fluoro in.
Just give me 1 second, please. Yeah. 1 second. Thank you.
All right, let me know when you're in position. Are you in position, Jordan? So far, some great questions. I'm going to take the needle out, leaving the guide wire in. Going back in through the same little cut, 7 millimeters. This time we're going to L4-5, what we're calling L4-5. Shot. Yeah, we're already there.
You can turn on the light and put this one, please. Yeah, yeah, it's fine. Thank you.
Shot.
Thank you.
Perfect. So this will be our second and last disc. Then we're going to move on to the facet joint treatments. You're okay. I can tell you right now, his discs are quite scarred from chronic damage. Chronic means a long time ago. These discs were injured and herniated. And when I talked to the patient, he told me that he's been working construction for his whole life, and he was lifting heavy things, heavy cement, and you know, really put a lot of weight through his spine over the years, and that's really caught up to him. So great, good work. Yeah, yeah. He has been weightlifting for his whole life. All right. We're getting ready to do the second disc. Let's go down and take a look. What's happening? Scope on. All right. I need that. Yep, perfect. So this is the L4-5, what we're calling L4-5. Some other people might call it 3-4 because there is a fake disc down below. We're not counting that one. Really not a lot of herniation, just small little pieces. Fingers crossed, yes. Great. Is that a problem? Luis?
The piece was fine? Yeah. Is that attached correctly?
Let's see the grabber. Verify the attachment. Light on.
What is it? What is it? Can you check again the mirror again, please?
Luis, you want to scrub out? Would it help, Bill?
Check again. Just can we turn off the machine again?
Uh-huh.
Yeah, turn off. Turn off. And check again the mirror, please. Yep.
All right, let me have the grabber.
Yes, sir.
You go ahead and put the laser fiber down. Good news is I'm not getting a lot of herniation out of here. So,
Check the mirror without touching the glass. And tell me if
Luis,
it's,
leave me and focus. There. All right.
Yeah, there should be another one there.
I got it. Jordan, are you helping over there? Mm-hmm. Great. Any questions, Henry?
No current questions.
Oh, he's doing fantastic. Stable? How's our irrigation? Pressure's perfect. Thank you. Seems to be working nicely. Yep. Mirror. Mirror, mirror, huh?
Yeah, it's a glass, but that glass protects. Again. Give me a favor. Do we have another laser fiber back there? Laser? Yeah. Yeah. Can you please bring it?
All right, Jordan. Come on in. Scope off.
Facet?
Yep. Take your time, Luis. I'll take care of this. Jordan, come on in. Leave that alone. Just leave it here. Take care of the other stuff.
Take it out, but leave it there. I'm gonna leave it over. It's not the laser fiber.
Oh, Henry, we're going to switch over to the DPR, so we stop broadcast.